So you have pain in your vagina, you have that fullness in the rectum, and you have pain going down your legs or leg, and you're wondering, is this something else? Is everything falling apart? This all has to do with some really interesting part of your body that is so easily fixable. That's the subject of this video. Stay tuned. Hey, this is Dr. Shakib from Core Pelvic Floor Therapy in Irvine, Orange County. I already named some of the symptoms of a muscle trigger points in a muscle called Obturator internus. So let's back up a little bit. Trigger points are lactic acid buildup. They're the knots that you may be familiar with, like in the back of your neck or in the top of your shoulders, that you press on and it hurts. Well, those trigger points can happen in every muscle of your musculoskeletal system. Obturator internus is one of them. Obturator internus, its job is to help in movement of your hip joint outward like that. So it's one of those muscles that helps with the external rotation of your hip joints. That is involved in pelvic floor dysfunction. So while you may have incontinence or other symptoms related to pelvic floor dysfunction, you may have pain in your vagina, it kind of shoots and then it goes away, or you may have that fullness in your rectum, you just can't figure out, is it constipation, what exactly is it, or you have that pain that you keep referring to as your sciatic pain because it's in the back of your thigh, and people somehow think as soon as you have pain in the back of your thigh, that must be sciatica, and the answer is no. These are all signs and symptoms of trigger points in the obturator internus. So how do you fix it? When it comes, let me back off here a little bit. It's so important to be aware of these things so you don't wait until there is the problem gets deeper and deeper and more intense. So when you have that shooting pain in the vagina, don't overlook it because it went away. That could be like a beginning, hello, I'm on my way to get worse type of situation. So how do we get rid of the trigger points in the obturator internus? Well, we can get into it two ways, from outside and from inside. In fact, most of the times from the outside, which is what I mostly do with my patients, it solves the problem. Does it help to go on the inside? It's one of the deeper muscles of the pelvic floor that is actually reachable. So from the inside, we can go in and then address it. However, it doesn't have to be. My suggestion is approach it from every angle from the outside, correct your posture and the way you move around. And then from inside, maybe have a few sessions just to get rid of some of those trigger points that are not accessible from the outside. So in our practice, our approach is almost always that way. We want to address the cause and the feeders of the cause for pelvic floor dysfunction. If you have any questions, make sure you use one of the methods of contact in the description box. And if you need an appointment, just call the number. Thanks for watching. Take care.